So my name's Amy Chapman. I am a board-certified obstetrician gynecologist, and I'm very proud to be working here at Women's Health Domain. So menopause is the time in a woman's life where she is generally somewhere in her late 40s to 50s, and she's gone an entire year, 12 months without a menstrual period. So that's what defines menopause. In this country, the average age is 51. It's different in other countries. In India, it's 46, and other countries it can go up to 52 or 53, but here in the US, the average age is 51. Many women will start having symptoms actually before that time. So the absence of a menstrual period doesn't define when our symptoms start. Women can actually start having symptoms 5, even 10 years before the menopausal time frame. That's the time frame that we label as perimenopause, okay? Women can start having symptoms that disrupt their lives: hot flashes, night sweats, vaginal dryness, and even symptoms that they're not even sure are related to menopause or perimenopause. Things like heart palpitations, bone pain, muscle pain, sleep disturbance. All of these are a result of the fluctuations in our hormones that are starting in those years leading up to menopause and then through that menopause transition. There will be over 1 billion women in the world that are menopausal in the next year, okay? If women live a normal average lifespan, a woman will spend about 40% of her time on this earth menopausal. There's no reason for women to suffer. We just want to make sure that our patients are aware that we are here to listen to them and are here to help them with their symptoms. And many of the things that we do in helping our patients through this menopausal transition will also help with longevity and staying healthy into those menopausal years. Diagnosis comes from the absence of a menstrual period for 12 months, but there are women who've had a hysterectomy, use IUDs, have had an ablation, and they're not menstruating. So in those women, it's their symptoms that will tell us if they need management. So those patients that are coming in with hot flashes, night sweats, vaginal dryness, sleep disturbance, mood disturbance, we know that those people are candidates for management. And the fact that their hormones are at a certain level or a different level, that doesn't really impact how we take care of those patients. We treat the patient and their symptoms. We're not really interested in treating just the lab. So they can vary from non-hormonal management, so things like acupuncture and supplements, things like pelvic floor physical therapy to help with their pelvic floor strength and those types of things, all the way through hormonal management. There are women that have a contraindication or cannot utilize hormones, so we're here to help them with their symptoms. There are pharmaceuticals on the market that will help with hot flashes, and then all the way through to those patients who really are great candidates for hormone replacement therapy and know that hormone replacement therapy has kind of gotten a bad rap in many years because of some studies that were done about 20 years ago. But we now know the safety profile of hormones and that we can manage people very effectively and can actually impact their wellness throughout the years, even following the transition from perimenopause to menopause.